Okay, so welcome to OET Academy. So we're doing a practical writing class. We've done introduction, we've done address, we've done headings, we've done some parts, taking how to expand case notes. But then we just need to look at how to really write a case note if we're being faced with a case note in the exam. So for the writing test, we know that this test is for healthcare professionals and then nurses, doctors, most especially. But then there's room for pharmacists, physiotherapists, and all healthcare workers, even dentistry. Okay, so the structure, I'm here now. All right, so the task basically is to write a letter. So most times the exam is usually a referral letter. In fact, most of our candidates are writing the exam all. Okay, except maybe one Saturday where one of the candidates had an update letter. So an update letter is very similar in structure, but you just have to tweak a few things. But most times, often than not, you have a referral letter, and then the referral letter are mostly cold cases. Please, can we mute our mics, please? Dr. Nwake, go. I think your mic is on. Thank you. All right. So, and other kind of letters you have will be transfer letters and discharge letter. Usually, most times, the discharge letter are common with the nurses. Okay, so a letter to advise or inform the patient. Okay, you can also have that. An update letter or an information letter. Okay, so along with the instructions, you receive stimulus material, case notes. So in the exam, they'll give you a case note, all right? And then when they give you a case note, it includes all the information that you need for the exam. And then you're given 5 minutes to read the case note and then 40 minutes to write the letter. So in total, you're having 45 minutes as it's written up here, okay? But then 5 minutes out of 45 minutes is for reading and then 40 minutes for writing. Now, let's look at this. So how are you really assessed, for your writing? We know that most times, especially for the doctors, you need to have a 350 to have a band B for your OET. And then for the nurses, you have to have at least a 300. But then how can you get the scores or the desired score that will enable you, to have a pass mark in the exam? First of all, you have to look at purpose. Okay, so I'm still going to practical session. I'm just doing an overview, okay, of what you should expect while writing. So first of all, what's the purpose of the letter? So whether the purpose of the letter is immediately apparent to the reader and sufficiently expanded in the course of the letter. So what they mean by purpose is, what kind of letter is it? Okay, is it a referral letter? Is it a discharge letter? Is it a transfer letter? Okay, so if they say write a transfer letter, your writing must indicate that it's a transfer letter. So when you're expanding the case note, you're expanding into the idea at the back of your head, okay, that this is a referral letter, or this is a discharge letter, or this is a transfer letter. So that's for the purpose. For the content, whether all the necessary information is included and accurate for the reader. So for example, let's say you're writing a letter to, let's say you're writing a letter to a dermatologist, okay? And then in the case notes, they put things like the patient had maybe a skin cancer, some years ago, for example. Maybe the current presentation, maybe it's another skin disease, maybe it's psoriasis, for example. That's the reason why they are referring at this point in time. But then dating back in the patient history, the person maybe had like a skin cancer, like let's say 3-4 years ago. And then you're writing your letter, you feel that 3-4 years ago is not important. Let me just look at what happened, the reason why we're referring this patient today. Now, for the fact that you did not include that the patient had a skin cancer some years ago, you lose some marks because those are necessary and vital information for the dermatologist. Okay, so your ability to sieve information and know what is necessary to be put in your letter is an important part of your scoring system for your OET. And then the next one, which is conciseness and clarity. This one deals with your ability to remove unnecessary information. So for example, I'm writing to a dermatologist for that patient that has a psoriasis, right? And then I'm including, he had a fracture 2 years ago. And then another thing is he had, let's say, a brain tumor. 4 years ago. Really? How is it really important for the dermatologist? In as much that it might be in your case notes, it does not have any relevance, okay, to the person you're writing this letter to, which is a skin doctor. So you have to be very careful not to just write all the information. And that is why they give 180 to 200, okay, for the writing limit. Now, as I said earlier in the last class, I said you don't need to follow the 180 to 200 strictly. So for example, let's say you wrote more than 200 words. No problem. At the end of your writing, don't start cleaning things that, oh, I have to make it between 180 to 200. No, the 180 to 200 is given to you as a guide, because if you're writing too little, it means you're not following the content criteria. It means you're not writing enough information from the case notes. If you're writing too much, for example, someone is writing 340 words, 350 words, it means that you're not concise enough and you're not clear enough, meaning that you're adding irrelevant, okay, or unnecessary information, okay? And that's why that guide of 180 to 200 is being given. So the next one is your genre and style, whether the register, tone, and use of abbreviations are appropriate to the reader. So for example, I'm writing to an occupational therapist and I'm using certain abbreviations, okay? Like maybe cerebrovascular accident. For example, I'm using CVA, okay? Because you're writing to an occupational therapist, it's not appropriate because he may not understand what CVA means, okay? But if I'm writing to a neurosurgeon, I'm writing to a neurologist, I'm writing to a doctor generally, if I use CVA, it's fine. He should understand what I'm trying to write in that context. So you have to be very important on what you're writing in that context, so that you don't just, veer off from what is important. So the fifth criteria here is organization and layout, okay? So your organization and layout. So how the letter is organized. For example, I'm supposed to write introductory paragraph after writing my heading. And then I just started my first paragraph with Mrs. Larry presented today. I didn't give any introduction. It shows that the person is not organized, because at the beginning of your paragraph, the first thing you should write is an introduction. And then there are certain things to note. For example, if it's an urgent letter, after writing your introductory paragraph, the next thing to write is today's visit. Okay? So if you do not write today's visit after your introductory paragraph in an urgent letter, you've missed out point in organization and layout, because you must be strategic. You must know what should come and what should not come. For example, let's say it's a cold case. Let's say the person just had ulcer, peptic ulcer disease, and we're referring to a specialist. All right. And then my introductory paragraph, I wrote an introductory paragraph. Okay. Cold case, so peptic ulcer disease, cold case, not urgent. I wrote an introductory paragraph. The next paragraph, I'm not writing today's visit, when I'm supposed to start with how the symptoms started initially and then progress down in my organization or my thoughts down to today's visit. Okay, so today's visit should come almost to my last paragraph, but then I'm starting today's visit in a cold case after my introductory paragraph. It shows that your layout and organization is not nice. And again, for example, let's say in the letter, in the case note, they give you October 2019, this patient presented to the hospital in a case note. And then they wrote something like the complaints. Let's say they wrote diarrhea, fever, headache. The next part, they now wrote laboratory findings. Okay. Then the third line, they now wrote vital signs. Okay. We know as medical professionals that after writing the presenting complaints, the next thing to write is to write the examination findings and vital signs before writing the laboratory findings. And then in your own layout and organization, you now wrote complaints, wrote laboratory findings, now came in that same paragraph, now wrote the examination findings. So normally it's supposed to be a sequence, it's supposed to be organized. Even though the case note is never organized, they don't design the case note for organization. Okay? They don't design the case note for organization. Can you with me? They don't design the case note for organization. Okay, so it will be a challenge if you don't know how to organize your letter. So I'll be giving practical examples. So don't worry, I'll put you guys through. Now, language, very important. Last criteria. So whether the accuracy of your grammar. So your grammar must be very important. Your vocabulary. Okay, you cannot be using very, very funny words, or you want to use high vocabulary for things that doesn't make sense. Okay, so it has to align properly, your vocabulary. If I'm saying significant, okay, it must be appropriate. If I'm using things like that, my spellings too are very important. Okay, in your writing, spellings are not important in OET listening. Okay, so for example, if I'm writing blood pressure, and maybe OET listening, I wrote PRESUR. Okay, they will still give me that score for listening. But then for writing, they're looking at spelling. How accurate is your spelling? Okay, and then your punctuation is very important. So for example, I will show you guys some certain places where punctuations are very important. So now, if you have all these things, your organization, your language, okay, the gender and style, the conciseness and clarity, the purpose, and the content, you should be looking towards having a 350 number. So I'll be giving us a sample. Let me enlarge my screen a little so that we can see what's been written. Can you all see my screen?
Yes.
All right, so you can see my screen now. All right, so this is like one of the subtests. This is a code case, and then I'll scroll down. Now look at this. Now they said reading time 5 minutes, writing time 40 minutes. Okay, most times. So assume that today's date is 30th August 2019. So most times on your exam day, the date of referral is likely most times coincide with the dates of your exam. So for example, for those who are writing the exam 8th of October now. So most times your dating will be like 8th of October. Okay. So now they say you're a doctor in a city clinic. Mr. Knows is a new patient. Very important. So when you're writing your OET letter, you must know if it's a new patient or is it an old patient. Important. And I will give you insight on that. Now, these are the patient details. These are it appears. Okay. You see Mr. Adam Knows, 22nd, they give you the date of birth. All these things are very important in your address. Now, they give you a social background, as you can see. Married, 2 grown-up children and stuff. But then let me just go down quickly. Because when you get the case notes, all these things are not so important first. You first have to go down. So you scroll down first. Say, what are these people telling me to do? I need to be sure. Is it a referral letter? Is it a discharge letter? So I'm scrolling down. Okay, I'm scrolling. Now let's look at this together. Let's look at this. Now look at this ending part. The ending part is showing me writing task. Okay, so now let's read in our mind. Okay, but then let me read it out. Using the information given in the case notes, write a letter of referral. So we know it's a referral. Okay, to Dr. Desai, a gastroenterologist at City Hospital, for assessment of Mr. Knowles. Okay, address the letters. Okay, all right. So first of all, we know that we're writing what? A referral. But then what kind of referral? We're writing, we don't know yet from here. We don't know what kind of referral letter it is. We just know that it's a referral letter to this gastroenterologist. But then let's go up to the plan. Let's go to plan. So when you're given a case, now these are the things you look out for. What is the writing task? What is the plan? Now, what does the plan say? The plan says urgent referral to gastroenterologists for assessment and endoscopy. Urgent. So we know this is an urgent letter. This is an urgent letter. So, all right. So what do we need the gastroenterologist to do? To assess this patient and then, for possible endoscopy, which is a procedure being done. Then another thing you now look out for is what are we really managing this patient for? What does this patient really have? So most times, often than not, you see it in the plan or you see it in discussion. It depends, but you see it towards the ending part of the case note. It might not be always at the plan, but then you might just see it at the discussion part. You might see it at the plan. But, usually towards, the recent visit, most times you see the diagnosis, okay? The most recent visit. Now look at this. They wrote pancreatic malignancy, okay? It's what we are dealing with. So it's a query, okay? So when you see this query sign or this question mark sign, it shows that, all right, it's not really a definitive diagnosis, it's still provisional in the sense that it can be subjected to change. All right, we're not sure yet, but then from the clinical features or the signs and symptoms this patient is presenting with, it's likely that is a pancreatic malignancy. Okay, so we have things in our head. One, we already know that it's an urgent referral. Two, we know we're referring to a gastroenterologist. 3, we know why we're referring to the gastroenterology. We're referring to gastroenterology to assess this patient or otherwise evaluate this patient. And then for a possible endoscopy. That's the 4th thing. Now, the next thing that we know that the diagnosis hovers around the fact that this patient might have a pancreatic malignancy, which is queried. So we are not sure. This is very important. This question mark is very important because if they didn't put the question mark, okay, you will know that they've confirmed that it's pancreatic malignancy. So when you're writing, hello?
We can hear you.
Hi, sir, we can hear you.
Okay, all right. So hold on. Okay, so I said urgent referral to the gastroenterologist for assessment and endoscopy. So query pancreatic malignancy. So those are the things we are looking at. And then we want to be sure that we're in tandem. Okay, I think my screen is out. Hold on. I think my screen is out. Let me reconnect. So I'm trying to reconnect. Just give me a minute. Restore this. Hold on, let me try to project the screen. Hold on, please. So just hold on.
Yeah, we can see your screen, sir. I can see your screen.
Follow through on how to go about this letter. Now that we've known that it's an urgent referral, we know we're writing to a gastroenterologist, we know we need assessments. The gastroenterologist, what we need the gastroenterologist to do is to assess or to evaluate and then probably provide endoscopy. Okay, and then the diagnosis is queried. We're still suspecting, okay, that's pancreatic malignancy. So we're not so sure. And that's why we need the gastroenterologist to properly assess this patient. All right, so now let's go down. Let me just scroll down. Scroll down. Okay. All right. All right. So now look at this. You can see here now I'm addressing. Okay, so I wrote Dr. Dave Desai. That's the name of the doctor. Right. Everything is in the case note. Now, this is why I got every information so that we don't get confused. Now look at this place. You can see Dr. Desai, gastroenterologist at City Hospital. So when you see this information, look at it again. They said address the letter to Dr. Dave Desai. You can see it here. Gastroenterologist, comma again, City Hospital, comma, Eastern. So now, usually, most times, after each comma, okay, you can put the next word on the next line. So for example, Dr. Dave Desai, first line. The next line, gastroenterologist. The next line, City Hospital. The fourth line, Eastern, okay? All right, I think Eastern wasn't here, but then Eastern should have been down here, okay? So something like this, all right? So you have Dr. Dave Desai, okay? Gastroenterologist, City Hospital, Eastern. Remember that I showed you all the dates at the beginning. So there'll be a space, okay, between the address and the dates. So 30/08/2019. I could have also have written it as 30, 8 is August, right? So I can write it as 30 August 2019. Fine. I can choose that format. But then remember that I said if you choose that format, you have to follow through with that format. All right. So after that, you leave a space, okay? And then you write, Dear Dr. Desai. Remember this time, I'm not using Dev Desai. Dev Desai was his full name I used at the address. But then coming here, I'm writing, Dear Dr. Desai, okay? And then I'm writing okay, which is the heading. Now, this is greeting. So this Dear Dr. Desai is a greeting. Okay, so this is heading, date, which usually coincides with the date of your exam. Remember, I said that most often than not, the date of your referral most times usually the date of your exam. Okay, and then this is Dear Dr. Desai, which is the greeting. And then this is the heading. Mr. Adam knows, that's the name of the patient, then date of birth, 22nd/08/1951. So this is the heading. Now, how do you write this introduction so that it will make a lot of sense? All right. So let me just reduce this a little. I hope people can see it. You can zoom in from your screen or from your phone so that you can see it properly. Now, look at the first way I wrote this. Remember, we already know that this patient has, pancreatic malignancy, and then it's an urgent referral, try to see one. Now, this is the first one I used. I said, thank you for seeing. It's one of the ways you can use to write a referral letter in OET. So thank you for seeing Mr. Knows. So I chose his last name, right? Now, some people say choosing the first name is bad. If you choose the first name, you have to be consistent with the first name, all right? But then most often than not, it's preferable, as I always say, to use the last name. You can use the first name, you don't have any issues, honestly speaking. But then, normally it's preferable just to use the Knows. Okay, so thank you for seeing Mr. Knows, comma, okay, A68. Now look at this. There's a dash, year, dash, old, okay, retired management consultant. Look at, there's a comma here. So these punctuations are very important. So I didn't just say, thank you for seeing Mr. Knows, comma, a 68-year-old management consultant. I put a comma again. So whenever you are giving the age and probably the occupation, okay, or I can just say a 60-year-old man. I can use that too. But then if I use the age and put the occupation or the gender or the sex of the patient, I'll just put a 60-year-old man. I should still put a comma after that. So I can say, thank you for seeing Mr. Knows, a 68-year-old man, comma, okay, who requires, now look at this, who requires urgent. So in urgent letters, okay, you must put urgent in it. So urgent must be there. Okay, so urgent, it must be in your introduction. So if it's not urgent, fine. Just say, if it's not urgent, I would have written who requires investigation. But then if it's urgent, I should write urgent. Okay, who requires urgent investigation of his upper GI symptoms, of course, because we're not sure whether it's having pancreatic malignancy or not. We just say, okay, fine, upper GI symptoms. You can use that. And then in the body of your letter, you can now expand, which I'm going to show you all. Okay, that's one aspect. I'll take questions, please. But then let me go to the next one where you can write it. So I said, thank you for seeing Mr. Knows. Another way, with clinical features and laboratory findings. Remember, if you go up to the case note, I'll show you where they put some laboratory findings that we are suggestive. But then I said, are in keeping. We're not sure. So it's in keeping. We're suspecting. Are in keeping with pancreatic malignancy. Full stop. Okay? Then it was now written that your urgent assessment and further investigation would be appreciated. All right. Remember that in the case notes, it was assessment that was written. Okay, so in OET writing, if you have something that can replace certain vocabularies, okay, you can change it if you want to. For example, I can easily say your urgent evaluation, okay, which is a similitude to assessment, or which is a synonym to assessment. So I can say your urgent evaluation, right? It gives you more mark, okay. It makes the examiner, feel that you have lots of vocabularies. As I mentioned, one of the things that you're having marks for are your vocabulary. Okay, so your urgent evaluation or your urgent assessment, Okay, fine. And further investigation would be appreciated. That's one way. Another way to write this is saying, I would like to request that you urgently evaluate Mr. Knowles, comma, whose clinical features and laboratory findings are in keeping with pancreatic malignancy. Now, who can tell me what is wrong here? Now, one, never write your diagnosis in capital letters. So all diagnoses are written in small letters. Okay? So that's why I had to change this now. So I would like to request you urgently evaluate Mr. Knowles, whose clinical features and laboratory findings are in keeping with pancreatic malignancy. He would benefit. You can see. Remember the previous one I said, your urgent assessment will be appreciated. Choose anyone, please. It's not necessary to cram all the old styles. I'm just giving you different styles, okay? When you're practicing, you choose one or two that you're very, very, very comfortable with writing. So you can see, he would benefit from your further assessment and investigation. All right. Now let's look at this. I will show you how everything is very similar, okay? When I'm done with reading the four. So now look at this. I'm writing to refer. So refer has come here now. Okay, so I know some people say, why do you not use refer now? So if it's a referral letter, you can use refer. You can use any of them. Okay, still correct. So I'm writing to refer Mr. Adam Knowles to you for urgent evaluation and endoscopic investigation, or an endoscopy, anyone you choose. He's being evaluated. Remember when you say someone is being evaluated, it means you're not sure. So I didn't say it's being managed. If I say it's being managed for pancreatic malignancy, it means I've confirmed the diagnosis already. I'm not sure. It's still being evaluated, okay? So it's being evaluated for pancreatic malignancy with worsening GI symptoms. Now, let me now go through all of them and show you how they are very similar. Remember I said in the introductory class that certain things must be in your introduction. One, what kind of letter is it? All right, so this one, thank you for seeing. When you say thank you for seeing, most times it's a referral letter. So we already know this is a referral letter. Thank you for seeing. We know it's a referral letter. Okay? All right. I would like to request that you urgently evaluate. It's a referral letter. Okay? And then I'm writing to refer. It's a referral letter. So this must be in your introduction. So if you discharge, I'm writing to discharge. Okay? So know that it's a discharge letter. One. Two. What do we need, or what the diagnosis of this patient, okay, or the sign and symptom of this patient? Remember when we read in the case note, we saw that the patient was being queried for pancreatic malignancy. So we have to find a way to put it. Either I'll put it in symptoms or put it in the diagnosis. Here, I said investigation of his upper GI symptoms. Still good. You can use that. As I said in your introduction, either you use the major symptoms, okay, or you use the diagnosis itself, right? But then I decided to use major symptoms so that you can see that it's not cast in stone. You can still vary these things. Okay, but you can see my introduction is having the symptom. Very important. Your introduction should not be too long. It should not be more than 3 lines, honestly speaking. If you're writing more than 3 lines, it's X for me, because that means you're already bringing things supposed to be in your paragraph. You're bringing it already in your introduction, right? So it's upper GI symptoms, okay? Now look at this. Say, thank you for seeing Mr. Knowles. Now look at this. Whose laboratory findings and clinical features are in keeping with pancreatic malignancy? So pancreatic malignancy here, okay, all right, is the diagnosis, all right? So your diagnosis or the major symptom and sign should be in your introduction. That's the second thing. Now look at this. Then the third thing you need to know is, what do you need the person you're referring this letter to do? What do you want him to do? Do you want him to play with the patient? Do you want him to dance with the patient? You know, what do you really want him to do? You want him to clap for the patient? Do you want him to hold the hand of the patient? I'm just joking. But then there are certain tasks, okay, from your task. You already know what you want that person to do. So for here, we want the gastroenterologist to do something. What do you want him to do? Look at this first one. I said it requires urgent investigation. I've already told the gastroenterologist what I want you to do. From the introduction should capture a summary of the whole moment of what you want to write in your letter. So I need an urgent investigation here. Okay. Now this second one says urgent assessment and further investigation. I'm already telling the gastroenterologist, this is what I need you to do. My patient has clinical features and laboratory findings of pancreatic malignancy, but this is what I want you to do. Finish. Okay, urgent assessment and further investigation. Same thing too with this third one. Okay, you can see it will benefit from your further assessment and investigation. And then this is the diagnosis here too. Okay, for the third one. Okay, you can see they're all similar. It's just the way you can write it. All right. So that's for that. Then this one too, you can see this is diagnosis here. And then this is what we want the patient, the consultant gastroenterologist to do: urgent evaluation, Abi, and endoscopy. Now, let me give you a trick. Now, if you're writing your introduction, you can start the first sentence with what you want the specialist or the nurse or the doctor to do. And then your second, line or second sentence of the paragraph should now be maybe what the symptoms or what the diagnosis of the patient. Or you can reverse it. You can start your first sentence with what is the diagnosis of the patient. And then the second part of your sentence can be what you want the person to do. Now, this is what I mean. Now, look at this last one I did here. Look at this. Please just follow through. I started this with what I wanted the gastroenterologist to do. So I said, I'm writing to refer Mr. Adam Knows to you for urgent evaluation and endoscopy investigation. I can start with that. Do you know, I can also say, I am writing to refer Mr. Adam Knows to you. I'm writing to refer Mr. Adam Knows, who is being evaluated for pancreatic malignancy. I can also use that. Yes, I can use that. And then my second line will now be, he would benefit from your urgent evaluation and endoscopic investigation. Fine. Or I can use it the same way I used it, bringing, what I want the specialist to do. In this case, the gastroenterologist to do first in the first line, first sentence. So I said, I'm writing to refer Mr. Adam Knows to you for urgent evaluation, okay, and endoscopic investigation. I can bring that up. Or I can say, I'm writing to refer Mr. Adam Knows, who is being evaluated for pancreatic malignancy. I can use that. Any of them use is correct. Whether you bring this one above or the one below, it doesn't matter. Now look at this other one up. This first one. No, this second one, sorry. Let's look at this. Thank you for seeing Mr. Knows, okay, whose clinical features and laboratory findings are in keeping with pancreatic malignancy, meaning that I brought the diagnosis up, and then I now brought what the gastroenterologist should do in the second sentence. But then I can also tweak it. I can say, thank you for seeing Mr. Adam Knows, who is being evaluated. No, thank you for seeing Mr. Adam Knows, who will benefit from your urgent assessment and further investigation. I can do that. And then my next line will now say, he is being managed for suspected pancreatic malignancy. Anyhow, okay, there is no hard and fast truth for this. But in all of this, one, what is the purpose of your letter? In this case, urgent referral. So it must reflect in your introduction. Two, what do we want the person we're referring this letter to do, or the receiver of the letter to do? In this case, we want him to evaluate and probably, do endoscopic or investigative findings for this patient. Now, there's a third part of this that I didn't put here. All right. And then that one is common with transfer and discharge letters. And that third part is the clinical update. So clinical update means, let's say the patient was managed in a hospital, and then we now want to discharge the patient back to the general practitioner or back to the nurse, okay? I can give the nurse or the general practitioner that we received the letter update. For example, let's say I want to write that now. I can say, I would like to discharge Mr. Knows, okay, who was managed. Now look at follow through. It's not here. Just follow through in your head so that you understand what I mean of clinical updates. Who was managed for pancreatic malignancy. Then I can now say, and has made remarkable progress. Okay, so I can do something like this. I can say for a discharge letter, for a transfer or a discharge letter, I can say, I am writing to discharge Mr. Knows, all right, who was managed for pancreatic malignancy and has made a remarkable progress. All right, sorry. he would benefit from your continuous monitoring and support. Can you all see my screen, please?
Yes, sir.
All right. So now I'm trying to highlight this. I want to show you some background information. Okay. Now remember, I'm just giving you an example of how the discharge letter can be. All right. So now, if it's a discharge letter, one of the things you might need to add in a discharge letter is the update. Has the patient done poorly? Has the patient done bad? Has he made good progress? Has he made significant improvement? Okay, like the update, like what has, how's the patient fared, with your treatment? So, because, I wrote the purpose of the letter. I'm writing that it's a discharge letter, so I've already written it in my introduction here. All right. Then I've already said, what do you manage it for? Managing for pancreatic malignancy. But since it's a discharge, this one I discharged the patient back to me. I hope he has been doing fine. So I want to tell the GP or the nurse that, oh, he has made a remarkable progress, okay? Or he has made significant improvement, or has made a good progress, okay? And then he would benefit from your continuous monitoring and support, right? So you can see this has the purpose of the letter, which is discharge. 2, the diagnosis, which is pancreatic malignancy. 3, the update of the patient, and then what we want the GP to do or the nurse to do. And most times, because it's a discharge letter, it's likely for the nurse or the general practitioner to continue monitoring and support, okay, or to follow up this patient. So I can say you benefit from your follow-up, right? Something like that. So this is for like a discharge letter. So a discharge letter may have a clinical update, okay, or progress report, let me put it like that, okay, added to your letter, okay. So these are just samples of the introduction. And now, let me now go down. I had to do some, okay, thank you so much, sir. So I had to do some tweaking. Now, look at this. Remember that this is an urgent letter, okay? Now, look at my arrangement. Someone's mic is on. Okay, Dr. Wakego, your mic is on. Right. Okay. All right. Okay. I want us to look at this together. Now, this is my introductory paragraph. Okay. Now, look at this. Look at my second paragraph. Remember that this is an urgent letter, or please remember. I want us to respond. Now, my second paragraph started with the initial presentation for an urgent letter. So I don't know if I can get our responses. Do you think it's correct that for an urgent letter, after writing an introduction, the next line should be, or the next paragraph should be the initial presentation or today's presentation for an urgent letter?
It should be today's presentation.
Today's presentation.
Yes,
Today's
today's presentation.
All right. So now the reason why I had to do this way is because I want to use one stone to kill two birds. Okay. So I have to give you a balance between, because there's really no much difference between urgent and referral. It's just the organization. As I said, organization is very important. For urgent letters, you must start your second paragraph with today's visit. For urgent letters. Okay. For urgent letters, today's visit. If it's a cold referral case, cool, like no urgency, just normal, okay, you start with the initial presentation. But in this regard, this is an urgent case. So let's look at this. Let's look at this. Okay, so now, okay, so this is how you're supposed to start an urgent letter. So your urgent letter should start with today's visit. Okay, now let's go to the case note so that we'll follow through. So we can see how we can modify this. Now let's look at today's visit. Now this is today's visit. Let me zoom the screen a little. Can we all see it?
Yes, sir.
Okay. Now look at today's visit. Now this is today's visit. Now let's look at things that might not be important or things. Remember, this is pancreatic malignancy. So look at the first one. No improvement in reflux symptoms. Okay. All right. Now, patient concern is now back pain. All right. The patient now developed new symptoms. Okay. New symptoms was diarrhea, pale stool, abdominal pain on eating, fatigue. Okay. He has lost weight too. So sad. Dropped like 2 kg. Right. And then when they did an examination finding, it was tender abdomen on palpation, then it was slightly swollen, yellow discoloration, skin, and eyes. Please, when you're writing letter, not because they arrange it this way, you just come and write on 30th August, no improvement in reflux system, full stop. Patient main concern is now back pain, and he has developed new symptoms such as diarrhea. I'm just giving an example. Okay, pills to abdominal pain on eating, fatigue. He has lost weight of 2 kg. They now come and now say abdominal tender of palpation, slightly swollen, full stop. He also has yellow discoloration of skin and eyes. And then you now think that maybe you've done well. Please, this is a letter. Okay. And then you must be, have some swag, some fizzy. Okay, while writing. Now look at the pathology report. Okay, we can see some, high values, bilirubin, amylase, ALT, albumin, alkaline phosphatases, some liver function tests here and there, enzyme tests, for the pancreas, bilirubin, stuff like that. Now, so you look at this, okay, how can I arrange this? That's how to write. How can I arrange this? Okay. Now, please just have a photographic memory of this information. Now look at this. No improvement in symptoms, diarrhea, pills to abdominal pain on eating, fatigue. Now, let me go to a sample of how this was written. Okay, so I'll take you all to today's visit. Remember, I said today's visit comes immediately after the introductory paragraph. I'm just using this to teach us how to write referral generally, but how to use urgent. Okay, now, so if it's urgent, now look at this. I said, today, unfortunately, Mr. No's symptoms has deteriorated. Okay, I say I'm using big grammar now. Okay, so deteriorated. Okay, because if you go up, let's go up. I want us to be looking at this together. They said no improvement. Okay, in symptoms. So it's not me writing no improvement. I said, okay, fine. It's not doing fine. Deteriorating. Nothing special. Okay, so I'm coming here to say, so unfortunately, Mr. Nose has deteriorated as he developed, okay? Now I'm telling them now, he has developed back pain, diarrhea, and stool. Now listen. Remember that in the case notes, they gave us a gamut of new symptoms that he has presented with today. They told us back pain, diarrhea, pale stool, abdominal pain, okay, pale stool appear twice here, so it's supposed to remove. And extreme and fatigue, okay? Now, look at the way I wrote this. It is not nice that when you are writing in OET writing, you just put all the symptoms and put comma, comma, comma. For example, some people write as he has developed back pain, comma, diarrhea, comma, pale stool, comma, abdominal pain on eating, comma, and fatigue. No. Once your symptoms is getting to like 3, let's say 4, 5, split them. Don't put of them together. You can see I said, as he developed back pain, diarrhea, and pale stools, full stop. And I used a connector. Connectors are very important in your writing. Okay, it's not like IELTS that every of your sentence you are using consequently, subsequent, furthermore. No. Okay, now, but then I used a very good connector here. I said additionally. So I want to tell I said apart from these symptoms, so additionally, so I broke the symptoms. Okay, and I said additionally, comma, he also admits, okay, to abdominal pain on eating and extreme tiredness. Remember that in the case of the road fatigue. All right. So I'm trying to vary a lot of words. I didn't say fatigue here. Look for a synonym. What can I use? Oh, extreme. Let me just put some adjective to it. Extreme tiredness. So I said extreme tiredness here. Full stop. So instead of you writing back pain, comma, diarrhea, comma, pale stool, comma, abdominal pain on eating, comma, and extreme tiredness. When you're writing that list, you make your letter so boring. Just take like 2 or 3, put one, and use a connector to connect them. I say, even though I didn't also use, even though I don't use additional, for the fact I put a full stop and just use 3 symptoms here, I can just come here and start this new sentence with, he also admits. I can start it that way. Fine. But then if you have a good connector to connect it with, you have more marks. But then, regardless, if I also start this sentence with, he also admits to abdominal pain on eating and extreme tiredness, full stop. Okay, it's okay. Now, remember that I've already listed the symptoms the patient had. The next thing I'm going to is what? The examination findings. So for examination findings, you can say on examination finding, comma, you can use that. You can also say it was noted to have, okay, that's observation. Or it was observed, okay, to have, so I said it was noted to have lost weight. Remember they mentioned about weight loss of 2 kg from 94 kg. As well as, now look at this. Look at the way I connected this. So as well as is another good way, okay, to connect. Not every time you use and. So I said, it was noted to have lost weight of 2 kg from 94 kg, as well as having slightly swollen and tender abdomen. Now, I'll still go back to the case note up so that you appreciate this. Now, I now put full stop. Remember that I didn't come and put another connector. So it's not everywhere you put a connector. You now come and put subsequently, comma, his eyes. No, I can just start straight and simple. His eyes and skin revealed jaundice. Remember that they said someone mic is on, please. Nurse Blessing, your mic is on. Nurse Blessing. All right, thank you. So remember that in the case notes, they said he had yellow skin, and yellow eyes. I just summarized it. I said his eye and skin revealed jaundice. I mean, simple and that. Full stop. Pathology reports showed significantly high liver function, including, you can see including, I use including here, including serum amylase. I put the result in brackets. So you can put your result in brackets. And bilirubin, 9 milligram per dl. Okay? 9 milligram per dl. This is one way to write it. Now look at another way I wrote this. Now look at this. I said today, comma, he reports. So instead of saying complain every time in your writing, he complained of, you can use reports. Okay? So it's not every time you need to be writing he complained of or mention this thing. You can say he reports. You can see now. Today, comma, another way of writing it, he reports having developed back pain and diarrhea. Okay? You can see it now, comma, pale stools. As well as, you can see, I'm using as well as. So as I say, as well as is one of the good ways of connecting your words. Okay? So that you don't be putting comma, comma, comma everywhere. Okay? So I said, as well as abdominal pain on eating and fatigue. So as well as, see, as well as appeared here again. So it will not be nice for you to say, today, comma, a report having developed back pain, comma, diarrhea, comma, pale stool, comma, abdominal pain on eating and fatigue. No. Tweak it. Today, a report having developed back pain and diarrhea, comma, pale stool, as well as, okay, as well as abdominal pain on eating and fatigue. Okay, full stop. And I said his indigestion has not improved. Okay, you can use this is a simple sentence. You can use some simple sentence. Now, but look at this next one. I said Mr. Nose has lost 2 kg, okay, over the last 4 weeks. Okay, and now I'm going to examination findings. You can see now. And his abdomen is slightly swollen and tender. Full stop. His eyes and skin show signs of jaundice. Full stop. Then, here, his blood test showed deranged liver function test with raised bilirubin and enzymes. His amylase was also raised at 400, U per liter. So now, this is another way of writing it. Okay, you can see that I first took the symptoms first, went on to the fact that he has lost some kg. Okay, you can see I then try to always write, the name of the patient, even though it's once in the paragraph, especially when it's a long paragraph. You can see I brought Mr. Nose here. Okay, here too I brought Mr. Nose in the beginning. Then others I was using he, is, I was using pronoun, and then using one or two things. So today, he reports having developed back pain and diarrhea, pays to as well as abdominal pain on eating and fatigue. His indigestion has not improved. Okay, Mr. Nose has lost 2 kg over the last 4 weeks. And okay, so when you use and, you make the sentence compound. Okay, someone's mic is on. Dr. George, your mic is on. Okay, thank you. All right. So, and skin shows signs of jaundice. Okay. Then I said his blood tests showed deranged liver function with raised bilirubin and enzyme. Okay. His amylase was also raised at 400 U per liter. So now it's important that so I didn't just go directly to this case note, to today's visit, and start writing it exactly as it was. You can see back pain was there, but I know that back pain is a symptom. Okay, so why can I just add it to those symptoms and say he reported, back pain, and then add it to diarrhea and pills to put full stop. Now say additionally, he also complained of abdominal pain on eating, okay, and maybe tiredness or extreme tiredness, fatigue. Then the next thing was the examination findings. So you have to report he has lost, 2 kg. Remember, if you go up to the case now, you see that he has lost it for over 4 weeks. Although you can just say he has lost 2 kg from 92 kg, and as well as having tender abdomen on palpation and swollen abdomen, something like that. Okay, as I wrote. Then this one now, instead of writing it exactly like yellow discoloration in the skin and eye, I went to say, okay, his skin and eye showed, jaundice, okay, or reviewed jaundice. Then I went on to the pathology reports, okay. Then I liked everything. I can just say his liver functions was significantly elevated, okay, all right, including, okay, I can now put maybe including albumin and alkaline phosphatase. I may not necessarily have to write all the whole findings, but the fact that written maybe liver function was elevated, and then I just, said including albumin and maybe amylase, okay, I can just carry these two because all of them were high. So there's no need writing every information. Okay. So now this is how you summarize. So your connectors are very important. Okay, while trying to summarize. So using things like additionally, okay, or in addition is good, especially when you're having a long list of things to write. Okay. And then another thing is that some people come and use subsequently. You only use subsequently when an action was taken from the previous information. So for example, let's say after all these things now that was written here, okay, they now told me that it was commenced, maybe they placed him on maybe omeprazole. I'm just giving an example. So let's say they wrote omeprazole somewhere here, maybe it was giving omeprazole, 20 milligram PD, I can now say, I can use a connector like full stop. After that full stop, now I can say subsequently, okay, comma, he was commenced on omeprazole 20 milligram twice daily. Okay. Now, because I know that subsequently means after we found out from his symptoms, after we found out from examination findings, after we've done tests, we now had to give him medication. So subsequently from the previous event that has happened, subsequently from the clinical findings, subsequently from the examination finding, subsequently from the laboratory findings, okay? We had to do that. Okay, so I'll be sharing connectors probably after this so that we see how to use connectors. So there are some connectors in OET writing that are outdated. So for example, you cannot start a sentence in OET with also. Now, for example, I could have easily said today, comma, Mr. So and so reported back pain, diarrhea, and pills too, and I put full stop. And I say also, comma, he complained, please avoid using also. Okay. So avoid using also, okay? While, just hold on, please. Okay. Can you see my screen? Okay. Can you see my screen?
Yes,
Okay,
we
can you
can.
also see my screen? Okay, all right. So there's some words, there's some words you should not use for connectors. Things like also, hence. Okay. So things like also, hence. Things like, so as I said, it's not necessary that you use connectors in all of your sentences. You can go as simple as possible, okay, to just go straight to the point. Okay, this is not IELTS here that you need to be bamboozled. It's a letter writing, it's not essay. So you're not going to write it subsequently, consequently, furthermore, however, everywhere. No. Okay. Now let's go up. Let's go up to today's visit, to the initial visit. Sorry. Now look at this initial visit. So this was the initial visit here. Can we see it? So initial visit, they said heartburn, indigestion. The patient took over-the-counter antacid. It did not work. It was ineffective. Okay. So when you're writing, be looking for things. Okay. If you say ineffective, what else can you use to replace ineffective? Who can tell me what? If you're writing this letter now, I say, I don't want to use ineffective, but let me shine small. Let me use another word. How do you think you can write this? If you want to replace this ineffective.
Refractory.
Okay, so refractory to over-the-counter antacids, right? Fantastic. So you can use refractory if you want. What else can you use? Thank you so much.
Oh, unsuccessful.
Unsuccessful. Okay, so it was unsuccessful with over-the-counter antacid. Okay, fair enough. What else?
Not helpful.
Not helpful. Okay, yeah. I hold down on my left hand. Okay, what else? So you can say which was non-responsive, Babi. So I can say which was not responsive to over-the-counter antacid. Babi, it was not responding, Abi. Or which was refractory, as she said, to over-the-counter antacid. So what I'm just trying to bring out in essence is when you see certain things that you can easily replace with a good synonym, it improves your mark. You get better score for it. The patient concerned with hernia. Okay, patient concerned with hernia. Do you think this information is important for the gastroenterologist?
No, sir.
It's not important.
It's not important.
It's not important.
Okay, so now in your writing, if you gotta include this thing, you lose marks because, as I said earlier, you are scored for your ability to remove information or to sieve out information. So you must be concise and then you must be clear. Okay, so it's not important. Now let's go to the objective examination findings. So they said full examination, NAD, okay, weight 4 kg. Then the patient was now placed on omeprazole, okay, and then ordered full blood count and liver function test, and then was asked to be reviewed in 4 weeks' time. So now let's go to today's visit, to initial visit. Let's see how it was written, so that we'll see how to follow through. Okay. Now let's look at this. Look at this. I said he initially presented, okay, on, okay, this will be on, okay. Now look at this. No, look at this way I wrote my date. Now see the way I wrote my date. Remember that it followed the similar dating system I used for my address and heading, correct? Right? Hello?
Yes.
We can hear you.
Okay.
Yes.
No, I said it followed. Can you still see my screen?
Yes, we can see it.
All right. So I said, remember, I followed the similar dating system with with the way I wrote my introduction, that's the address in the heading part, or the address to August 2019. I wrote it fully. Okay. Hello, can you hear me?
No, I'm listening, sir.
All right, sorry, there's an interruption. All right, so let's say I wrote it in that format. I should follow the similar format in all of my writing. That means similar dating format. Though because I use this format in my address and the heading, I had to use it similar. Now look at it initially. So this is a very good word to use. Okay, when stating that the patient, this was the initial visit. Okay, so initially presented on these dates. Okay, reporting, you can use reporting, or complaining, anyone you want, complaining, reporting, or with complaints of indigestion. Remember I was saying indigestion there, which was non-responsive to over-the-counter antacid. Okay, as someone said, which was not relieved. Okay, you can also say which was not relieved. Okay, with over-the-counter antacid. Okay. Or which was refractory, okay, to over-the-counter antacid. If you want to now use big grammar, you now say something like which was recalcitrant, okay? So recalcitrant is a bigger vocabulary, but then, okay, which was recalcitrant to over-the-counter antacid. Full stop, okay? Then I said following a normal examination finding. Remember that the examination finding was normal, right? I said following, very good way to start. Following a normal examination finding, comma, he was subsequently, look at this word, okay? Look at this word. This is a connector. This is a connector. Subsequently, it's a connector. Okay? All right. So it was subsequently commenced on proton pump inhibitor. All right. And I wrote the medication. Okay. So now look at this. Now look at the way I wrote medications. Please, writing your medications in OET writing is very important. Okay. Don't worry, we'll soon be concluding. So, because I wrote omeprazole, comma, are you seeing it? 20 milligram daily. Can we see it? Omeprazole, comma, 20 milligram daily. Okay, so now, if you're writing generic medications, okay, like omeprazole, for example, you write it in small letter. You can see my O was in small letter, okay? And then everything was in small letter. Then remember that I put a comma. A comma was put, okay, after this name of the medication. And then I put 20 milligram daily. Okay. So in OET writing, you might be given several prescriptions. Okay. And then it's important that you know how to write them. And I said, whenever you're given a prescription that is more than 2, okay, that means 3 and above, you separate them with what? What did I say in the last class? With what?
A semicolon.
With a semicolon. So for example, let's say I have omeprazole. So just follow through. Let's have omeprazole 20 milligram, okay, daily. All right. So I'll use a semicolon, okay? I'll use a semicolon here. I will now say paracetamol, okay, maybe 1 gram 3 times daily, and Lipitor 20 milligram daily. Right. Are you seeing my screen? Can you all see my screen now? Now, look at this. Now, this omeprazole, is it correct? The way I wrote this omeprazole, is it correct? With the capital letter O?
No.
No, because it's a generic medication. So I write it like this. All right. So omeprazole. But look at this. If you're having like 3 medications to write in your OET writing, please don't just write omeprazole, comma, 20 milligram daily. You now put comma, paracetamol, comma, 1 gram 3 times daily. And no, separate them. If it's just 2 medications, if there were 2 medications you're just writing OET writing, you can just come here to say omeprazole, comma, 20 milligram daily, and paracetamol, comma, 1 gram 3 times daily. That's if it's 2 medications. You don't need to use semicolon. But then when you're having 3 and above, okay, or more than 2, say omeprazole, comma, then you separate the first and the second, okay, with a semicolon, and then the second and the third with and. Okay, same thing if you're having 4, first and second with a semicolon, second and third with a semicolon, and the third and the fourth, the third and the last medication with and. Okay, so that's how you go about it. Now you can see very simple. Initially presented on these, complaints, and then we've written our initial presentation. Now let's go to the next presentation that the patient had, so that you see how to summarize this information. Now this was the second time. This was the second time patient visited. Yeah. So after this, patient came here again on this date. Now look at this. Remember that this date now is now today's visit. Look at it, Abby. This second date is today's visit, right? Hello?
Yes, it is.
This is not today's visit. So now we've exhausted this because we put it in our today's visit. Then we brought this other. Now, remember, for the newcomers, people that have not written, that are not very conversant with OET writing, I'll recap again. If it's an urgent letter, after writing your introductory paragraph, your next paragraph should be the today's visit. Do not write initial visit or the first presentation. And also, do not write other part of the history. What do I mean by other part of the history? Do not put family history, social history, medical history, allergic history. For urgent letter, immediately after your introductory paragraph, the next thing is today's visit. After that, you now start going down to initial visits and then subsequent visits. Then after that, you can now come and now tell us with a paragraph about the allergic history, past medical history, social history, everything in one paragraph. Just lump them up. Now, for example, this is what I mean. Now, if you go up here, okay, you will see some information that are important to the gastroenterologist. Okay, we're concluding. Now, look at this. Now, let's look at it together. Do you think married 2 grown-up children, is it important for the gastroenterologist?
It's not.
I need your rest. It's not important. Okay, so we remove that one. So if, the moment you're removing information, you're getting marks. So that's why OET is sweet. Now look at this other one. Recently retired management consultant would have written that in the introduction, right? For example, thank you for seeing Mr. Adam Knows, a 68-year-old retired management consultant. So you might write down his introduction, but then it's not important in the body of the letter. So physically active, oh well. Plays tennis and work, may or may not be important, so not too important. But then look at this, non-smoker for the past 10 years. Is it important?
Yes.
It is, sir.
Yeah. So anything that's to do with smoking and drinking, no worries, important. So non-smoker for the past 10 years, social drinker, as important information to add in your social history. Okay, let's look at. Now, family history, nothing was what? Significant. So we move on. We move. Now, this medical background, severe childhood eczema, is it important for someone that is having these symptoms currently? Do you think it will help the gastroenterologist?
No.
No, it would not. All right. But then let's say it was a dermatologist. It would be helpful,
Yes.
right?
Yes.
Exactly. So a skin doctor will be helpful. You remove this one. You don't need to write all this information. You now come again, 2008, gallbladder removed due to gallstones. Do you think it's important?
It is, sir.
Who said yes? Who said yes, please?
Manuel.
Okay, well, why do you say yes, please?
Oh, because it's part of the GI tract.
Yeah, so exactly, fantastic. Because we know it's part of the GI tract. So it's a GI symptom. No matter how you want to look at it, gallstones is in the abdomen. So whether or not you know whether it relates to pancreatitis or not, put it there. But of course, we know that gallstones, okay, are one of the risk factors for, but then we're not moving medical stuff. As I said, it's not a medical class, right? But then, because it's an abdominal, issue, the gallbladder is in the abdomen, closely related to the liver, and all whatnot. It has to be important. So you must put this, okay? And then history of depression for the past 4 years. Is it important?
No, it's not.
Not important. We're not writing to a psychologist. We're not writing to a psychiatrist, right? So it's not important information, right? So our important information here is this. So let me highlight it. So we have, okay, Cannot highlight it. So we have non-smoker for the past 10 years, social drinker, right? Gallbladder stone, removed and stuff. Then let's go to medication. This SSRI, that's the fluoxetine. Do you think it's important? No, since depression was not going to be written, Abi. We know that this one is an antidepressant, right? So you don't need to write it. So these are important information. So how do you write this? Now remember, look at this. Okay, so look at this. Now look at this information. All right. Can you see my screen now? No, it's still moving.
Yeah, we
I
can
can
see it.
see it, sir.
All right. So now look at this. Fourth paragraph. I wrote social, medical, family, and allergic history. Okay, just lump them up together. Remember that the woman did not have any significant family history, and then there was no significant allergic history. The only thing we got information for was from our medical history and then our social history. All right, so you can say Mr. Knowles consumes alcohol socially. Okay, however, now look at this. This is a very, very good connector. All right, so this is a very good connector. Trust me. All right, so some people just come and just make the. You see, the more if you use connector in the right way, you make your sentence complex, and then when you make your sentence complex, you score more marks. Score more marks. Okay, so imagine. Let me use a compound sentence for you now, so you see how it sounds. If I say Mr. Knowles consumed alcohol socially and he stopped smoking for 10 years. That's compound sentence. So simple sentence means, for example, Ali is a boy. Okay, that's a simple sentence. If I want to make that sentence compound, I'll say Ali is a boy and can play football. So the addition of and, okay, as a conjunction there has made it compound. But then if I want to make it complex, I can say Ali is a boy and can play football. However, comma, he does not play well at night. Maybe he has night blindness, okay? I'm just saying. But then I've used however, although, okay? So although is another good connector. So here too, I can say Mr. Knowles consumes alcohol socially. Although, comma, I can use although too. Okay, I can also use although. Okay, although, comma, look at it too. Although, comma, I didn't say there's a comma after that. So most times when you use a connector, most times a comma should follow them. Okay, so however, although he stopped smoking for 10 years. Okay, and I said he also. So now look at this also. So remember, I didn't use also at the beginning of the sentence. Some people will write it like this. Some people will do like this. Also, he had, okay? Also, he had cholecystectomy for. Please don't start your sentence with also. Yeah? Don't start your sentence with hence. Don't start your sentence with thus. Don't start your sentence with but. Don't start your sentence with and. The list is plenty. All right, but then I'll share the connectors. So rather, you can use all this in between your sentence. Okay. So for example, he also, so you can see also is in between. All right. He also had cholecystectomy for gallstones in 2018. You can use that. Okay, so the second one, I said Mr. Knowles is usually fit. I just had to add fit. Okay. And I said, and he's fit and well, and he's a non-smoker. Okay. I just added the social drinking at the end. I just said his past medical history includes a cholecystectomy in 2018 for gallstones. So you can use this. All right. His past medical history includes, okay, a cholecystectomy in 2018 for gallstones. Still the same thing. Full stop. He drinks socially. But then remember that if I use this, he drinks socially, okay, I've made it a simple sentence. All right. but rather I can bring it up here and make it complex. All right. So if someone writes it this way, you get better scores. Okay. Now you just bringing it as a simple sentence down here, as we did here. I just wrote this intentionally, okay? To tell us how to make this sentence very interesting. Okay? Let me put it in red.
Can I ask a question?
Okay, I'm coming. Let me just this. Okay. All right. Mr. Emmanuel.
Yes, sir. Thank you
All
first
right,
and foremost. Yeah. Just concerning your second, like the example, the social media company. Like in your second example, like, you didn't specify that you stopped smoking for 10 years. I don't know. Don't you think that 10 years detail is important? So.
Okay. All right. Okay. So thank you for that question. Oh well. He's a non-smoker. I was just trying to be present. Okay. I'm just trying to bring information to the present. Okay. So I brought these two options. Okay. So that at the end of the day, you tell me which one was preferable. Do you understand what I was trying to do? Okay. So that you understand that you have to go to certain details to give your writer very good information. So for example, if I'm to pick any of this, they're still trying to share. Can you see the screen now? Can you also see the screen?
Yes, sir. Yeah.
All right. All right. So you can see. So the thing is, I brought both of them so that you see that this one was the preferable one. Okay, because you have to try to make your sentence complex. Once in a while. Just very, make it not too simple all the time. Just come and write, he drinks socially. See the way I brought he drinks socially to the end. Okay, something that I could have added with the non-smoker and then make it complex. Usually fit and says, although he drinks socially, simple. Okay, and then he's particularly history. So for your question, of course, this one was more detailed, saying that he has stopped smoking for 10 years. Okay, it's a preferable way to write it. Preferable way to write it. So you have to tell.
I can't see your screen. Please, sorry.
You can't see my screen. Hold on. Okay, just hold on, please. So while we wait for the screen to pop up, if you have any questions for me, so that we'll round up, and then the recordings will be available.
Good evening, sir.
Good evening, Elizabeth Orji. I can hear you loud and clear.
Okay, I want to ask as a recap from what you have said so far. You mean if we are giving urgent writing, after the introduction, the next paragraph should be the current report. That's what the patient presented at that moment.
Exactly.
Then the third paragraph should come for investigations.
No, I didn't say third paragraph for investigation, please.
Okay.
I said once you write your introduction for urgent letters, okay, the second paragraph should be everything that happened in today's visits.
Okay.
Everything
Like
plus the presentation, the examination finding, the test results, everything should be lumped in that paragraph for today's visit. Same thing. So when you now go to your third paragraph should be the first presentation. That's the initial presentation. But then that third paragraph should also include the report, the complaint the patient had, what examination finding was there, okay? What were the
What you're
investigations?
talking about now, is it for the urgent visit or urgent referral or cold one?
I said urgent. For urgent, after your introductory paragraph, your
Yes.
second paragraph is today's visit for urgent.
Mm.
For cold case, after your introductory paragraph, the second paragraph should be your initial visit.
Okay.
For cold case.
Okay.
Initial visit.
So all the investigations and everything presented, we should come on that second paragraph. No need of splitting it for urgent. That's
You're
what
not getting me.
saying.
You're not getting me. Let's go back. Let's go back. You're not getting me. You're making a mistake. Let me show you. Let me show you something. Hold on. Okay, so look at this. Look at this case note. Look at this case note now. Look at this case note.
I can see it.
This is today's visit. This is today's visit. Plus, look at this. They said no improvement in reflux symptoms. Patient's main concern is now back pain. New symptoms, diarrhea, pains to abdominal pain. These are complaints, Abi.
Yes.
Now, we now went on to say he lost 2 kg. Then his abdomen was tender on palpation. These are physical findings or examination findings, right? Then
Yes.
also, we also noted they had yellow discoloration of the eyes. Now, this is by the investigation the patient did, right? This one. Bilirubin. All this information falls into today's visit. And because they fall into today's visit, every information here should be in the second paragraph after your introduction. I'm not saying that you write you presented with back pain, diarrhea, pills to abdominal finding. You now go to the next paragraph.
I know. I got how you said we should write it. I want to know where coming, whether when we said the signs and symptoms in the second paragraph, we'll now go to third paragraph to say the invest. That's what I want to understand.
No. But it's clear now.
Yes.
All right. Thank you so much.
Yes.
All right.
You're welcome.
Thank you. All right. Okay. I'll just take like 1 or 2 questions so that we'll call it a day. Any questions? Okay. All right. I'm sure it was clear enough. So let me just recap before we close. Now, for your social history, that's family, social. This last one I showed you guys, this particular one. Okay, this one in purple here. Can you see this? Okay, have you seen this? This 4th paragraph. This one I wrote social, medical, family, and medical history. Remember, in OET writing, there is no number of paragraphs. Any number of paragraphs you use is okay. But then the recommended one most times is between 3 to 5 paragraphs. Okay, but even though you use 6 paragraphs, it's not a problem, right? But then you should not be seen to be writing too much paragraph, right? That's to show that you can easily summarize information. That's what it means. Now look at this. Now this information, okay? For urgent case, now listen. For urgent case, your social, medical, family, and allergic history should come before your conclusion. So after you've written introductory paragraph, urgent case, the second paragraph should be today's visit. 3rd paragraph and 4th paragraph maybe should be the previous visit. Okay, so the initial visit and then the subsequent visit. Now, before you now conclude, add the social, medical, family, and allergic history in another paragraph. So before your conclusion for urgent case, please, if you see anything significant in the social, medical, family, and allergic history, please include it. And then after that, you now come to your conclusion. Now, this is how to conclude. Now look at this. Look at this conclusion. Look at this. Okay. So look at my conclusion. I said, I am quite concerned, okay, that Mr. Knowles has suspected, remember that this is not a confirmed diagnosis, it was queried, has suspected pancreatic malignancy and would benefit from your further evaluation and possible endoscopy. Okay, now look at the second one. I said, I would be grateful if you could see Mr. Knowles at your earliest convenience for an endoscopy and assessment, as I am concerned about the possibility. Remember that it's not a confirmed diagnosis. It's a possible diagnosis. So that's the amazing possibility, or the possibility of pancreatic cancer. Okay. So you can see I'm starting my sentence, or I'm bringing in some, emotional angle to it, saying that I'm quite concerned. Very important. This other place also wrote, I'm concerned. So you can say, I'm concerned with that Mr. Knowles has suspected pancreatic malignancy and would benefit from your further evaluation. Because I use assessment in the beginning, if I'm writing my conclusion, I don't need to repeat vocabulary. I can use evaluation here. Possible endoscopy, right? Then after that, what are we supposed to write? Who can tell me, after you've written this, how you conclude? How you write the last statement? You write, if
You're faithful.
If you have, any queries, they kindly, contact me, All right, so there are plenty of ways, Now, this information that I put here, all right, now, there are many ways to write this. Now, look at this information. If you have any queries, kindly contact me. Please always end your letters in a similar fashion like this. Or if you need further clarification, reach out to me. Anyhow, there are different ways to write it. Now, this information I wrote here does not add to your word count. It does not add to your word count. Remember that your word count is between 180 to 200. But then I also said that OET does not count your words in your exam. They don't count it. They don't count it. Please, they don't count it. All right. But then it's just like a guidance so that you don't write too much or too little. Okay. So, but then you see this information that I wrote at the end. Okay. Or contact me if you have any further, if you need further clarification. So you can also say, contact me if you need further clarification. See, there are plenty of ways to write this thing, don't worry. You can use this one. Now, this information is very important. It adds to your score, but does not add to your word count. So if you're counting your word should stop at this place, this endoscopy. This place I wrote endoscopy. This other information that you can write, if you have any queries, kindly contact me, or contact me if you need further clarifications. They don't add to your word count, but they add to your scores. They add to your scores. I should expect that as I'm seeing your writing, this is really the last thing I should be seeing before saying yours sincerely or yours faithfully. Now, for yours sincerely and yours faithfully, if the name of the person you are referring the letter to is given, if the name of the person is given, that's at the beginning. They said, remember at the beginning they said that they wrote Dr. Dave something, Desai or something. So if that name is given, you end it with yours sincerely. If the name of the person you are referring the letter to is given, you end with yours sincerely. But if the name of the person you are addressing the letter to is not given, maybe they wrote emergency nurse, or they wrote emergency doctor, or they just wrote anything, but they didn't put the name. Please, when you are concluding, use yours faithfully. Yours faithfully for when the information regarding the name, of the person that's receiving the letter is not given. So, for example, they wrote emergency doctor. You don't know the doctor. You don't know whether it's Dr. Ebuka. You don't know whether it's Dr. Anybody, So, if the name is not given at the ending part, you use yours faithfully. The name is not given. But then if the name is given, whether you're writing to an occupational therapist, whether you're writing to a physiotherapist, whether you're writing to a nurse, if the name is given, you use yours sincerely, to conclude that letter. All right. So if you have any questions, you can ask as we are calling it night. I'm sure we have tried. Okay. All right. So that's the conclusion. Anybody want to say something? Hello? Does anybody want to say anything so that we'll conclude here?
Hello, Doc. Hello.
Yeah, hello, ma.
You wrote yours sincerely. Whether the name is given or not, if I write yours sincerely or yours faithfully, I will write my name under it. Not this or the.
No name, please. If you
Okay,
write
so
just nurse or doctor, anyone.
okay,
Okay.
okay.
So if you write yours
Just
sincerely, you leave a
doctor
space. You leave a space, then you now
and
write
then
nurse. Okay. All
or
right.
doctor.
Yours
Okay.
sincerely, leave a space, write doctor. No need to write your name. Okay. OET does not need your name. Okay.
Okay.
All right. Okay. Any further questions so that
Thank
we'll
you very
round up?
much.
I have a question. Please,
All right.
at the outline, the heading, the title, RE colon Mr. So. Is there supposed to be comma before DOP? Did you get
It's not.
that?
Yeah, I get it. It's not necessary. Okay. If you want to find, it doesn't remove from your marks. All right. So you can choose to and choose not to. Yes. So you can just say Mr. This and leave a space and write DOB and put a colon. Fine. You can put a comma if you want to. Fine. Any of them you choose is correct, man. All right. So those are just minorities, and then one does not need to, waste so much on it. Is that clear, ma?
Any need for comma after, before and?
Before, I didn't get that, ma.
Before and, you are connecting two things. Any need for comma before the and?
Okay, like this, and having a swollen and, okay.
No, we are connecting two things.
Yes, you don't need it. You don't need it.
Okay.
You don't need it. Once you use and, already is a connector already. So you have already separated the words, but then joining them together. So you don't need a comma. A comma is not necessary. Although some people just come and just write comma before the and. Fine. But then in normal English, you don't need a comma before and. Just and straight up. And just, okay, for example, I said it was noticed to have had slightly swollen and, okay, there's no need for me to writing slightly swollen now, then put comma and then say and again. So slightly swollen and, okay, tender abdomen. All right. So there's no need for putting the comma before the and. All right. So do you have any question? I think Dr. Ivui Gweta Onagateho. Something. You have a question for me, sir. Your mic is unmuted, so all right. So I think we'll come to the end of the class.
Dr.
Okay.
Hello. Sorry. Please have a
All right.
question.
See you. Okay.
Yeah. Even though I remember you said that they don't count the words.
Yes, please.
But how do we, like, if we want to know like the number of words written, how do we count? How do we know the number of words, even though they don't count the words?
I always say, just use mechanical. Just carry the words. Okay? If you know your average words, okay, for your lines, it depends on you. If it's not okay, fine. You usually write like 6 words. A line, you can multiply by the number of lines, okay, and then you know approximately the number of words you use, or you count it mechanically. When I wrote mine in the exam, I actually wrote 200 and I think about 215 thereabouts. I didn't even cancel anything. I just know that you're fine. So I wrote, I know that 180 to 200 is a guide. They are not strict on it. So what I did for my own was I counted it, okay, individually, and then I know that it was 215, but I didn't even use it. Okay, so as I said, if you know the number of words you write averagely on the line, you can multiply it by number. Okay, I know that, okay, this is what you have. All right, or then you can decide to count it individually. As I said, and I'll emphasize, if you write 180 to 200 words, yes, that's fine. If you write between that. But then the idea for that 180 to 200 words that you don't write too little, leaving out important information, and then you don't write too much, putting irrelevant information. Exactly. So they don't count it. I will share something on the group, on the Telegram group. You see where I've emphasized on it. You see where OET writes, they don't count. They'll tell you that once you are done in your exam, there is no need for you to count your word. What you should do is to look at your letter and see whether there's anything that you didn't add or anything that you need to remove, any grammatical error, any vocabulary you think you need to change. That was, I think, you should be focusing on when you are done writing your letter in the exam. They will tell you it's written there, rather than majoring in the minor, which is you counting your words. But then the reason why I said counting words are important is that if you are seeing yourself writing 250 words, that is wow. It means that You mean that writing too much irrelevant information. And then you see yourself writing 150 words or 140 words. I mean, you mean that you're not adding some relevant information, okay? So just like a guide, really. Okay, so if in the exam you write 220 words, you don't need to cancel it. You write 215 words, you don't need to cancel it. But when I get to write 230, 240, I should be bothered. Now, what am I really writing? Okay, I think I'm writing too much relevant information. And then you can look through again and then sieve out. And say, I don't think this information is important. You can find a way to, clean it, edit it, and erase. So just like a guide, really. But then, as I said, they don't count your words when they're marking. They're counting how well did you follow the purpose. Okay, how well did you use the right vocabulary? How well are you concise and clear with your ability to remove irrelevant information? And then also the ability to add the relevant information, and they're also looking at your organization and layout. Okay, how well do you organize with your thoughts? Did you bring this one before this? Did you arrange this before that? And things like that. Okay, I hope that answers your question, sir.
Yes, thank you.
All right, thank you so much. See you. All right.
Hello,
Okay.
Dr. Ebuka. I want to ask.
Okay, Irene. Must Irene?
Yes. Please, in this late address, where they wrote RE.
Yeah.
You use it in all forms of letter, both in updates, referral, and everything.
Your network seems not to help us, but please can you say it again?
Can you hear me?
Yeah, it's still not very clear.
Address. I don't know if you can hear me now.
Yes, better.
Okay. In writing address, the place they wrote RE. I think that should be referrals something. Do you use it when writing about?
Can you hear me?
Yes, I can hear you.
All right, so this is it. That RE doesn't mean it's not for all letters, please write RE. So RE doesn't mean that it's a referral letter. RE just means regarding to, okay, or referring to. So it's just like an heading, okay, that all this information I'm writing in this letter is hinged on this person's name and age. I don't know if you get my point. So that RE means regarding to. So this letter is regarded to this person, okay, or this letter is being referred to this individual. So whether I'm writing an update letter, writing a transfer letter, writing a discharge letter, or writing an update letter, please use RE, because RE just means that this is the subject, okay, this is the heading, and the heading is usually the patient's name and the age, which is informed like the biodata, okay, small biodata of the patient. So it's in regard to, so RE just means regarding to or referring to. It does not mean that it's for referral letters. Okay, it's just that you're giving a subject head that, okay, this letter concerns this particular individual, okay, and then this is the name of the individual, and this is the date of birth, okay, or this is the age of the individual. So I don't know if that's clear. I read.
Yes, thank you, sir.
All right, no problems. Okay, all right, so we'll call it a night. Yes, all right, so we'll be sharing other schedules of what the academy has for us this week. So, and those that are willing to join the academy, you can reach out to any of the owners or the admin of the group, and they'll be able to put you through. And as I said, the earliest date for the OET exam is 17th of December. Okay, for those that are still considering interest, and that's the last date for the year. Okay, so if you're having challenges, you can try to book yourself, all right, which is very important. But if you're having challenges to book yourself, you can contact anybody, in that registration group. When I mean anybody, the owners and the admins, okay, and then they'll be able to guide you through on how to make your payment. So from me and on behalf of Excel OET Academy, I wish everybody a wonderful night rest. See you all later. Good night.
Thank you very much. Thank you.
Thank you so much.
So welcome.
Thank you, Dr. Ebuka. God bless you, sir. Thank you, sir.